Hi friends, welcome to my channel. My name is Joyce and I am the one behind Joy and Hope. All right, so today I've got one for the ladies and we're talking all things breast cancer. All right, so my name is Joyce. I'm a physician associate living in the UK and working in general practice. Okay, so breast cancer, it's quite common, quite prevalent in the general population, more common with the ladies, but men can have it too. All right, so we need to know the signs and symptoms so that we can get ourselves to the doctor very quickly. Signs and symptoms are you might have a lump around the breast tissue, but even under the armpit as well. You might have a nipple discharge. So if you're not currently breastfeeding and you're having some kind of discharge, that's something to be concerned about, especially if there is blood in it. You might find that the texture of the breast might change on a specific area. So you might have dimpling on the breast. You could also have nipple pain. That's another, sign of possible sign of breast cancer. You might have the shape of the nipple changing, so nipple inversion. Again, that's a reason to be checked out. You could also have breast redness. The breast might appear bigger than the other one. You might also have some raised lymph nodes around under your armpits as well. So those are the most common signs of breast cancer. Okay, the next part is who is at risk of breast cancer? Being female, unfortunately. The next is being older, so more prevalent above 40, or having a family history of breast cancer or some of the other female cancers, all right, especially on your mother's line. Early onset of periods. So if you're someone who started having your periods earlier than 11, so that's a risk factor. Okay, going through the menopause later on in age. So the menopause in the UK, it's 50, the aged 50, give or take 2 years. All right. So if you're someone who's gone through the menopause later than that, that's a risk factor. Also, not having given birth. So if you've never been pregnant, never had children, and never breastfed, that's a risk factor for breast cancer. And also having the BRCA gene. We've heard about this, especially through the celebrities that we know of, especially Angelina Jolie and others that have had breast cancer. So BRCA gene, possessing that is a risk factor for breast cancer. How can you reduce the risk of breast cancer? So you can reduce the risk by, the lifestyle changes, not smoking, reducing your weight, avoiding alcohol, breastfeeding. If you've had the privilege of having children, breastfeeding is a kind of protective factor against that. Avoiding exposure to radiation like x-rays unnecessarily, CT scans, that kind of thing. And also lifestyle, physical activity, which goes in line with controlling your weight. That will go a long way in, reducing your risk of breast cancer. Some people are unfortunate that even doing all these things, you can still have breast cancer, especially if the genetics are working against you. In other words, if there is a family history of breast cancer. So in terms of treatment, so if you present with these symptoms, your general practitioner will likely refer you to the breast clinic. At the breast clinic, they will examine you and possibly, depending on their findings, they can then authorize a mammogram. And if there is any suspicion that, what's in there is cancerous, then you are likely then to go through surgery where they will possibly remove the lump, the tissue that's cancerous, or they might even suggest, which is called a lumpectomy, or they might actually remove the whole breast. Okay, you might also have chemotherapy as part of that, and also you might have radiotherapy as part of that. Another thing that they might do might be hormone therapy as well. So it depends on your situation what they are going to do. All right. So I hope this has been informative, and I hope you are aware of the signs and symptoms of breast cancer, which to me, that's the most important thing, to know what the signs are so that you can then advocate for yourself. All right. And go to your GP and be seen. So if this has been informative, then please like, share, and subscribe so that this might help someone else out there. Thank you, and I'll see you on my next one. Bye-bye.